Hello everyone, I'm Andre from the Mental Health. Welcome to this really exciting video podcast. I'm here with Matthew Hotopf and Sandrine Thuret and Alan Simpson from King's College London, and we are announcing a really exciting Wellcome funded PhD programme in mental health research for health professionals that's beginning soon at King's College. Matthew, tell us about it.
Thank you, Andre. It's a really exciting opportunity. So this is specifically for people who come from a registered health profession, and that could be doctors, nurses, psychologists, allied health professionals, and we're trying to get a wide range of different types of professional involved, because mental health is it affects everyone, and the clinical care which is delivered in mental health goes across a whole wide range of different disciplines. The challenge we have sometimes is that we're trying to build up clinical academic leaders, so people who are going to really be the able to progress the field, who've got an understanding of the kinds of challenges which our patients and service users experience, their families experience, and they know about that from on the ground, real life experience of offering clinical services and expertise, but also that they need to be trained in research in order to become effective leaders in on the research side and become, we hope, clinical academics. Not everyone will, of course. There'll be some people who will choose different pathways having done one of these PhDs, but it's a fantastic opportunity to strengthen the workforce. And the reason we're so excited is that mental health has become much more visible in terms of public discourse. It is, it's always there in the news. It's incredibly important. It's become, I think, a lot less stigmatized in the last 10 years. And you have, a lot of forces, government saying that they want to do more about mental health. But at the same time, a perception, I think, that the research, building the research capacity we need in order to deliver and innovate and make new, address the challenges, has been quite hard because there haven't been many opportunities. So the PhD program tries to help actually develop that capacity which we so badly need. And our goal is not just to get the diversity across professionals who might be able to help in mental health, but also to try and get a diversity in terms of the sorts of technologies and science which people do. So we've organized the program in three main blocks. There's one block which is around translational neuroscience, which is very much at the sort of biomedical end. And Sandrine Thuret, who's on the call, is leading that. And that's about sort of having collaboration between basic neuroscientists who are trying to understand circuits in the brain and clinicians, trying to see how that's applied in real life to people with psychosis or depression or whatever. Then there's there's a sort of cluster around digital and using data to get better insights into people's mental health, both using sort of big data from surveys and health records, and also some of these really exciting new therapies which can be delivered using digital methods. And then the third component is around policy and public health. So how mental health actually, understandings from research actually have an impact in real life settings and in terms of how governments frame policy and that sort of thing. So it's very broad, and we're hoping that everyone who comes on this program will be supervised both by a clinician and by someone with a methodological or scientific background which complements their clinical experience.
It was really exciting to me when I was first reading about it, because I thought, this is mental health research PhD, but for health professionals. And that in itself is quite a kind of revolutionary thing. And actually, you know, the problem that we all face here is this huge gap between research and practice. And so, Sandrine, I'm asking you, because what Matthew's just saying there about neuroscientists working with clinicians, that is probably an area where there is the biggest potential gap. You know, if you ask frontline practitioners all about neuroscience research, you're going to get lots of blank looks. How does this program kind of fit into that wider landscape? And why do you think now is the time to be doing this?
I think what Matthew gave a really nice overview, and what makes our program really different at this time is indeed, we know that to have a transformative mental health, we need to bring other disciplines together. So by the three different stream we have on translational neuroscience, digital and data science, and society and public policy, but what Matthew highlighted already is that one of the key points we'll have is that we'll have a fundamental scientist, a researcher, and a clinician pairing together. So we'll not have just a clinician mentoring the fellow, but also we will have basic and fundamental scientists. So, and we think that indeed we need to speak the same language, so we need to be working together to translate and back translate what we have learned, so from bench to bedside, but actually back as well. So learning from the patient, from the clinician who are on site to explain the basic, the fundamental scientists, what they observe, so that we have maybe better direction and then translate it back into the patient. So I think this is a really key aspect of the program, where we are going to work all together, clinician and basic, for example, neuroscientist in the context of your example. So I think that's one really, really good part. And what we did as well, what we think is quite unique, or maybe make our program special, is that we started with the students. So we went to our student and asked them, how would you want a perfect, near perfect program, or how would you see a program that would be better than what you are doing now, maybe a little bit more isolated. So that's why now we have developed a training that will be actually student focused, because these people, health professionals, are very busy and they will continue some of their work while they do their research. So we need this to be student focused and tailored to their needs. But at the same time, we want to have a cohort feeling. So they will have cohort training, they will have journal club together, but also in the first week, they will have a big session where we discuss research integrity, for example, diversity and inclusion. So we'll come back to that. So we want to have this cohort feeling, but also we have plans for this to be tailored to the students' needs for their project and their stream that they're going to choose.
So, Alan, who are you hoping to attract to this? What sort of range of people?
I think what we're looking for is clinicians, mental health professionals, other professionals who are out there working in the health service. They might be medical doctors, psychiatrists, psychologists, nurses, mental health nurses, occupational therapists. But they're people who are inquisitive, questioning, keen to learn from different people, different disciplines. They've probably done a master's or an MRes before, so that they've already got a bit of an inkling of an interest in research. But they're the sorts of people who are asking questions, wondering how do we improve our services, or why is this happening in this way? And they've got that interest in doing research. And like you say, perhaps have thought, I'm not sure I would be able to do a PhD. I mean, I'm someone who was a mental health nurse and still am, and came into academia quite late in life and had an opportunity to get to do a funded PhD, and it's transformed my life. And I suppose what I had when I made my application was that interest, that keenness to learn and find out and ask questions, and a determination to try and improve things, I suppose. So we're looking for people who've got that sort of mindset, who want to learn from people working in different fields, and also from patients and service users, to engage with and listen to them and hear what they see as the issues that we should be focusing on, and who want to learn methods, methodologies, different ways of applying research, working with different types of data, whether it's large data sets or doing trials or doing qualitative research. But an open mind to different approaches and willing to sort of talk about and discuss and share experiences with other people. It's very much about learning from one another as a group of PhD students, as well as developing those research skills.
And what about diversity, Matthew? We've spoken about this already. It's striking how diverse the mental health workforce is, but that doesn't kind of carry over to mental health research. Mental health research is not really that diverse, as far as I can see. How are you going to ensure you get the right people applying in the first place?
You have to think about this in a number of different, in a way, there are a number of different dimensions of diversity we're talking about here. So, of course, protected characteristics, we want to have a good mix of men and women and racial racial groups and people with disability or any of those sorts of protective characteristics. We're wanting to make sure that we are open, inclusive, and to have processes which reflect that. So, some of our procedures in terms of shortlisting are going to be based on being blind to people's identity and doing those sorts of things which have been demonstrated previously to improve your chances of having a diverse workforce. We also, I think, want to make sure that we're giving people an opportunity to test the water in the first place. So taking on a 3-year fellowship is a really big deal. It's a big commitment. As Alan said, you've got to be really kind of up for it and inquisitive and want to do it. And if you've come from a place where you're very much sort of steeped in clinical practice, it's quite hard to know whether that's for you. So what we're also building with this is a series of 1-year preparatory fellowships, which will give people an opportunity to start working with a potential supervisor or a couple of potential supervisors, get a bit of an experience, do a small project, but also start working up some bigger ideas and get a sort of sense of whether this is important for them. And we think this might be particularly applicable to some of the health professional groups who are less well represented in the health workforce, in the research workforce, sorry. So you may not have as many opportunities. There's a sort of track for doctors in training to be able to get some research training on the way, but that doesn't exist in the same way for nurses, for example. So we're hoping that we're going to be able to have an open door, give people an opportunity to explore. And then I think also in terms of diversity, we're interested in people who bring different perspectives. And, sometimes those are things you can't actually you can't necessarily pigeonhole. You want a particular type of person who's got this characteristic and this characteristic. It's actually people who've got life experiences who bring something interesting to the research environment. And so we're looking for a bit of that sort of spark and difference as well in the applications.
It strikes me that the sorts of questions that people are going to be trying to answer with their PhDs, given that they're coming from this kind of clinical world, are much more likely to be relevant to the clinical world and real life in the first place. But I guess another way that you can make sure that the PhDs are relevant to practice is co-producing the projects with people with lived experience and everybody else who's important. So how are you kind of driving that co-production agenda through this?
So this is part of the application process, actually. So we'll have just a first stage where applicants send their CV, a couple of question exactly to show us that they are interested in pursuing a research career, and then after there will be some networking event. If they are selected, then they can pair up with potential supervisor. And this is not where a traditional PhD program for non-health professional or clinician, where usually the projects are pre-written, prepared by the supervisor, and the student apply for this project. So here it's really the student and the supervisor are co-creator of the project. So very early on, then the student, the fellow, will have the opportunity to have an input, a strong input in designing their research project. And then the committee will give feedback. And this is going to be an exchange, a work in progress. So very early on, they will have strong input in the project they will carry out. So it will be their project, so their babies that they will take on to full PhD. So which I think makes it very attractive. It's not often you have this opportunity to do that. So I think that's what a really exciting part.
Yeah, I think in addition to that, right throughout the program, right from the very beginning, there will be a high level of input from people with lived experience. So there'll be teaching and training for all of the students to get them to think about, how do I work with patients and people who receive our services and work within our services? How do I discuss my research ideas with them, get their thoughts and views. So there'll be specific targeted training to develop that and to encourage all of our PhD students to think about how do I do that and apply that into their work. And that is going to be a thread throughout the program, that something people will be evaluated on. We will be looking for evidence of them, as well as working across disciplines, but also working with the patient voice and service user voice is really essential part of this program.
Excellent. And I guess Wellcome is changing a lot at the moment, aren't they? And they're developing this mental health science field, and mental health is a really big, top 3 topic now at Wellcome. How typical do you think, Matthew, this kind of PhD funding is? Is this a new way of funding this kind of work that's coming here from Wellcome, or are they just kind of tweaking things around the edges?
This funding scheme's been open before. We haven't had one of these programs at King's before. But other universities have had them and will have had programs renewed. I think what's different in terms of Wellcome's outlook, probably 2 or 3 things. One is that they've opened these were exclusively for medics, for doctors, and they've opened the field up for all the other groups we've been talking about. The second thing is Wellcome's done an awful lot of work around research culture and the research environment, and it's no secret that being an early career researcher in a university setting has a load of challenges, and some of those challenges are things which they're in a way they're part and parcel of the job, the work. They're part of the excitement, but they also throw difficulties. But others are real problems around research culture and how people are left feeling, I guess, in terms of being in a research group at a junior level, and whether their views are respected or whether they are treated well, frankly. And we are very much alive to all of those issues, and I think that the leadership team is absolutely clear about the importance of ensuring that supervisors know exactly what is expected of them in terms of looking after the people we appoint as fellows, and that there will be very significant sort of level of pastoral care and feedback from our fellows in terms of how they're looked after. And I think that for Wellcome, I mean, I can't say what led Wellcome to fund us apart from anything else. I mean, we were going for mental health, which is one of their big topics. But I think the other thing is that they really were very, very attentive to this issue about research culture.
And for people who are uncertain about taking the first step into this research career, I'm going to ask you all the same question in turn. What would you say, Sandrine, to persuade somebody who's umming and ahhing about whether they should apply for this program?
I think if people are interested in research and they are not sure they want to apply to the program, they should feel like they are going to be extremely well supported. We have put in place literally a ring of supporters. So we'll have all the figures on our webpage so people can look at that. But they will be extremely well supported. We haven't mentioned yet, but we have secured amazing external mentor who will take them through as well their program. And we'll have our internal personal tutor, which is very typical that what we do at King's. We have the King's Doctoral Training Partnership Program, so we have a lot of DTP, of which we are going to share workshops, so we will be able to pick some of these. And of course, they will have their research group, their home, their research department. And on the side of that, we have the bigger Center for Doctoral Studies that has a special stream now for health professionals that they are developing now. So that are really developing training specifically for health professionals doing a PhD. And then we have all our student bodies that they will be able to join and contribute to. So I think they should apply. They will be very well supported.
Great. Alan, what do you want to add?
Yeah, I'd say if you think you're interested, be no mistake, doing PhDs is hard work. It requires a great deal of resilience. You will undoubtedly always face challenges and difficulties along the way. I don't know anyone who's completed a PhD that hasn't. And you've got to be willing to battle through those. So if you think that's you and you think you really would like to give this a go, then I would say, have a serious thought about it and make a serious application, because, as Sandrine's touched on, the level of support that's built into this program is quite incredible. And I think you will be learning not just from your academic supervisors and so on, clinical supervisors, but your peers. And I think we're going to be building a sort of a body of support for students to get more support from one another, and that's often lacking in a lot of PhD programs. So I think that's a real welcome, good welcome addition to the program.